Hello everyone, good evening. I'm Shreya Dhondial. As always, it is good to see you. When is the third wave of COVID-19 likely to hit India? Good question. A lot of you have been asking about that. Two of India's top epidemiologists say it will come end of November, early December. End of November, early December. Dr. Giridhar Babu and V. Ravi, in an article that they have written for the Hindu newspaper, have written that it is not a question of if, but a question of when, and they have now given us a time frame. Now, history shows us that every successive wave tends to get deadlier. In India, of the 350,000 deaths in the last 1.5 years, 40% have been in the last 2 months. That is, in the second wave. So, the second wave was deadlier than the first wave. Will the third wave now be deadlier than the second wave? History is telling us it will. In the United States, in UK, even in the national capital, third waves have been far deadlier than the second ones. If you want to go back a little further into history, then let's look at 1918, the Spanish flu. Back then, the virus mutated and became deadlier with every wave, with each wave. So, essentially, two things are established. A third wave will come. It will come end of November, early December, and it will be deadlier than the second wave. Now, the question is, will it impact more kids than adults? The jury is still out on that question. The government and its doctors are saying not necessarily, but then they have gone right ahead and released a fresh step-by-step treatment protocol specifically for children. Talk about sending mixed signals. Remdesivir, according to the new protocol, is a big no for children. Steroids and CT scans should be avoided like plague, says this new SOP. I have two of India's best pediatricians joining me on the show today to tell us exactly how not to treat your children if they fall ill. Before that, it might be instructive to take a look at the treatment protocol for kids that the government has released a little more closely. Take a look. That is Dr. Arfa Sajadin from Howrah in West Bengal, being wheeled out of her COVID ward all smiles. She was on ventilator support for 10 days after her delivery, and this is the first time she's seeing her baby.
नहीं प्लीज अब इसमें थैंक यू वाली कोई बात नहीं। आप फाइटर हैं, जिस तरह से बेबी ने फाइट किया आपने ज्यादा फाइट किया है ना। बहुत आपकी टीम ने भी सर बहुत पूरी टीम किया।
Dr. Arfa's newborn baby didn't contract the virus from his mother, but many children did fall ill in the second wave. So before the dreaded third wave arrives, the government has issued detailed instructions on how to treat COVID-19 in children. In a major departure from its previous protocol, it's a strict no-no to Remdesivir for children. Why? Because there just isn't enough safety data with respect to administrating this drug on children. The guidelines issued by the Directorate General of Health Services also cautioned against the use of steroids in asymptomatic and mild cases. Like for adults, steroids, if necessary, need to be taken at the right time, in the right dose, and for the right duration. For mild cases, a 10 to 15 milligram dose of paracetamol is recommended every 4 to 6 hours for fever. Warm saline gargles in older children and adolescents have been recommended for cough. In case of severe illnesses, the treatment plan recommends antimicrobials and a 6-minute walk test to see if hospitalization is needed. This is for children above the age of 12 with COVID infection. Under the supervision of an adult, the patient is asked to walk in the confines of their rooms for 6 minutes with a pulse oximeter attached to his or her finger. This is a simple test to see if the symptoms are progressing to become hypoxic, so that if needed, the child can be hospitalized. The new guidelines have also cautioned against the use of CT scans since they have little impact on treatment decisions. The good news is that so far there is no data to suggest that the third wave will impact kids specifically. In the second wave, 70% children who needed hospitalization had co-morbidities or very low immunity. But as India unlocks and parents step out for work, children will be at risk. What compounds the worry is that there are no vaccines approved for children in India so far. So till then, what is required is utmost caution. With Shinjini Dev Burman, I'm Shreya Dhondial. Now to the big speculation. Will Wave 3 hit children the most? Dr. Devi Shetty sounded the alarm, but pediatricians across this country are saying that right now there is nothing to suggest that more children will fall ill in Wave 3 than in Wave 2. If the logic is that kids are unprotected because they haven't been vaccinated or will not be vaccinated by the time the third wave hits, hey, then that logic will hold true for almost 80% of the country. Parents, though, are worried because honestly, no one can be exactly sure which way this virus will behave. From Ranchi to Delhi to Mumbai, work is on in full swing to prepare for the third wave of COVID-19, and the focus of these preparations are children who, according to some doctors, will be the hardest hit.
The most important thing.
Dr. Devi Shetty, one of the most trusted medical voices in the country, has claimed that 165 million children under the age of 12 will be the most impacted.
I'm not sure whether there is a third wave. There's going to be a third wave. But if there is a possibility, strong possibility, it may affect the children, mainly because by that time, the adults are either infected or immunized. So they're unlikely to get the disease.
The apprehension has understandably set off panic amongst parents of young children. While vaccine trials are on for teenagers, it is the family of small children who are worried.
As a young parent, it is worrying, and at the same time, it's causing a lot of anxiety because there isn't enough evidence as well as treatment protocols for the young kids.
I implore that all efforts should be directed to getting a vaccine for kids ASAP.
We need to check if the vaccination works on them. We need to have proper supply of the vaccination, which we are facing a problem for even the 18 plus people. So Lord knows when the kids get vaccinated.
Adding to the anxiety are reports from several parts of the country about children catching the virus. Over 24,000 people below the age of 18 have got COVID-19 in the last 2 weeks in Andhra Pradesh. Out of these, 2,200 are children below the age of 5. In Maharashtra, one district, Ahmednagar, has reported more than 8,000 cases of COVID-19 amongst children. ICMR's own Sero survey has shown almost a 1-on-1 ratio for adults and children catching COVID. The last serological survey between December 17th and January 8th was conducted in a population above 10 years of age. The findings showed that 21.4% of the country's adults had suffered COVID by mid-December, whereas seroprevalence amongst children aged 10 to 18 was 25.3%. But so far, children have largely escaped COVID with mild or no symptoms. The worry is that in the third wave, children might need ICU support. The government's response to this possibility has been mixed. While guidelines have been issued for COVID management for kids, top doctors have also sought to play down the impact of the next wave on children.
If we look at data which is there from the first wave, the second wave, and from data which is there from waves which are going on across the world, one will notice that children actually have a mild COVID as of now. We have not seen any indication that the virus is causing more severe illness in young children and adolescents, and I see no reason why that should change in the coming months.
Many epidemiologists have pointed out that there is no basis to the claim that the third wave is going to hit the children hardest. They point out that there is not sufficient data to predict this, that the virus is mutating, and there is no way you can predict who they will impact and how much. But the parents have hit the panic button. Parks are empty, schools are shut, and this panic is forcing policymakers to take action to assuage the concerns of these parents. In New Delhi, Arunima.
On the show today, we have two of India's best-known pediatricians. Dr. Dhiren Gupta is joining us. He's in a car, I see. Dr. Gupta, Sorry, I think we've caught you at a wrong time, but anyhow, thank you for being part of the show. Professor Anupam Sibal, not on the road, very much at his home, I think. Thank you very much, Professor Anupam Sibal, for being with us as well. Professor Anupam Sibal, let me start with you, and let me start with that one question. I know a lot of you have come out to say that there is nothing to suggest right now that the third wave will be deadlier for children or more impactful for children than the second wave was. Tell me, what are doctors like you 100% sure that the third wave, we have nothing to worry about the third wave and children right now?
Good evening, Shreya. Always a pleasure to be on your show. So Shreya, before I get into this question, I'm going to make 4 or 5 points. First, the paper that you alluded to about the third wave will happen, and we have a kind of date. If it doesn't happen, I think the authors themselves will be delighted. Okay, we might have it. Will the third wave be deadlier than the second wave? I think we can't look at second wave was deadlier than the first wave because there was no vaccination. The Spanish flu, the third wave was deadlier because there was no vaccination. We will have significant vaccination if and when the third wave comes. So that's a variable. The second variable is how effective are we in COVID avoidance behavior. If we are smart about it and are sensible about it, then there is nothing to suggest that the third wave will be deadlier than the second. We will be better prepared. There are several lessons that have come our way from the second wave. So that's as far as the third wave goes. Third wave and kids, it's not that kids weren't impacted in the first and the second wave. If you look at the NCDC data, individuals less than 20 constitute nearly 12% of all COVID cases. Now, the good news is that kids respond very differently. Either the infection is asymptomatic or very mild, and they don't get into trouble. They don't need ICU care, and that's positive news. So even if children get impacted in the third wave, they are going to do very well compared to adults because we've got history. We've got history from India. We've got history and data from what's happened across the globe. Point number 3, we welcome the guidelines that have come out. It actually is something that all pediatricians across the country would welcome. It's great to have a document because, we are not only dealing with the pandemic, Shreya, we are dealing with an infodemic. So every parent knows tocilizumab, every parent knows the name of all the tests from D-dimers to IL-6 to HRCT. So it's great to have guidelines because then you can refer to the guidelines. So what have top pediatric units been doing in the country? Being very judicious about the use of steroids. Remdesivir was never a hot drug for us. It's not about safety. It's about very limited data on the efficacy, which is more important. HRCT, all pediatricians always say, think twice, think 5 times before ordering a CT. You don't want to expose children to radiation. So I think the guidelines are great. We welcome them. And a lot of units have been doing what the guidelines say. So that's welcome. Coming to the 4th point, vaccination. Vaccination trials for Covaxin 2 to 18 have started. 12 to 18 Zydus, the Indian vaccine started. We will have data on the Oxford vaccine. Well, the government of India is trying to get the Pfizer vaccine. And as you know, the Pfizer vaccine is approved for use between 12 and 18. And in the next 3 or 4 months, they will get approval for kids above the age of 2 based on their trials. So let's be optimistic. Maybe a few months down the road, we will have a vaccine for kids as well. Last point, should we prepare in terms of infrastructure for kids? Why not? I think it'd be great to have pediatric infrastructure, whether it's ICU beds or whether it's beds with attendants, because should kids need admission, they will need attendants with them. And the last point, kids, the manifestation are very different. And MISC does not require ICU care. It requires, in the vast majority, high dependency. So let's not get into this panic mode. And I want to reassure all the parents, please do not worry. All the information that comes your way, please discuss it with the pediatrician who will reassure you. Okay. That's very important. Knowledge out there needs to be quantified, qualified, and someone needs to go through with all the information out there. Okay. Over to you, Shreya.
Okay, Professor Sibal, why you said that you haven't factored in vaccination. The fact is that if you look at our vaccination pace right now, 3.4% of India right now vaccinated, and maybe 2% have antibodies because of infection that has happened already. That is only 5.4%, and our pace is not exactly encouraging, as it were, when it comes to vaccination. So I'm not very optimistic when it comes to 100% of India being vaccinated by the by the end of the year. Dr. Gupta, are you a little surprised? I was a little surprised as to, and I was wondering to myself, why has the government issued guidelines specifically for children right now? Is it something that surprised you, or do you think there is something that drove it?
I think government has already missed the bus, and they are quite late in issuing the guideline for adult for as pediatrics, and they definitely couldn't do anything good in the present pandemic which has just passed, and India has witnessed the worst scenario. What we witnessed means there was no oxygen, there nothing went right. Fine. Now, having said that, so it is something like a panic mode from the government side. They panicked, and it's a sort of panic button. What we are witnessing, what we are hearing is a third wave. My thought process is very different. Whether third wave is going to come or not, we should revamp our healthcare system. That is in very bad condition. Means whether you look at any government hospital, just leave aside some premier institute. If third wave strikes, the same thing should not happen what has happened in the second wave. One, not only to the adult, but also to the pediatric. Pediatric population, even if the adult COVID, you can say acute COVID doesn't strikes them badly. But multi-system inflammatory syndrome is one disease which requires resources. If it happened to the pediatric patient, the third wave strikes and MISC happens in the great number. We not only need to revamp our healthcare system in metros, but in the small towns, in the villages. What we have in small towns is an adult intensive care system, adult HDU well established. We need to train them. So my feeling is that revamp our healthcare system, whether it is going to be utilized for pediatric patients, whether it is going to utilize for the adult patient, hardly matters. We should train. For an example, this time there were many adult patients who didn't got the adequate treatment.
Correct.
So we as a pediatrician help them, we manage them. And not only online we manage, but also in the wards. So same thing, if for an example, as we are speculating that our vaccination pace is so tardy that very unlikely our pediatric population is going to get vaccinated over next 6 months. So they are going to be vulnerable population, even if the acute COVID doesn't affect them, but they can spread infection to the elderly and other people who, despite of vaccination, can have severe disease. So having said that, we need to train our adult intensivists. We need to train, actually, they don't need training, just they need little bit comfortableness with the pediatric patient. We need to train our adult nursing system to manage pediatric patient. As Dr. Sibal said rightly, many of the MIS patients just need HDU. So HDUs, ICUs, all those hospitals are there, already there. 6 months is not a very big time to have new system in place, but we can revamp our healthcare system. We can teach and train our healthcare professionals who deal with adult, how to deal with the pediatric. So in nutshell, what we need, a good vaccination, good vaccine, which also prevent infection. It's just not decreases the severity. Presently, we have got Covishield, Covaxin, which is fine to reduce the severity, means they doesn't let a very severe disease to happen in a vaccinated patient. But in pediatric patient who themselves doesn't suffer from severe disease, we need vaccine like Pfizer and Moderna. If given in pediatric age group, not only they will be suffering less from the infection, but the severity also be going to be less. Also, they will be less spreaders.
All right.
So in nutshell, we need to revamp our healthcare system. We need to have effective vaccination in pediatric age group. I hope that we get new vaccination, new vaccines, which Dr. Sibal mentioned, to be instituted in pediatric, and it should be done at a quick pace.
Dr. Gupta, I have 30 more seconds, so I'm going to go to Professor Sibal. Professor Sibal, in 30 seconds, can you please tell our parents who are watching this show how not to treat your children? Because for most children, I'm assuming the treatment will be at home. Can you tell us 3-4 things that they should not be doing?
Sure. Firstly, don't panic. 2, pick up the phone, talk to your pediatrician, do a video consult, do not self-medicate. Kids are not miniature adults, so please don't look at adult prescriptions and transpose them onto kids. And 4, please be judicious in applying the knowledge that you get liberally these days off the net when it comes to your own child, because you will imagine the worst. So please don't speculate, do not imagine, just pick up the phone and get proper advice. And really, the medication we use is minimalistic, from paracetamol to something to soothe the throat, and that's about it.
All right.
Rest needs to be done by a pediatrician. So please connect with experts.
Professor Sibal, thank you very much for joining us. Dr. Gupta, out of time, thank you very much for joining us. Up next, why are so many babies dying in Brazil? And what is the experience other countries with children falling ill have had? That report coming up next. Do stay with us. Welcome back. Brazil, one of the worst impacted countries in the world outside the United States of America and India, has seen 5 lakh deaths, almost. But the worrying wrinkle is the baffling case of young babies and little children dying because of COVID-19. 1,000 plus according to official data, but unofficial data is pegging this number at over 2,000. Why is it happening? Take a look.
Brazil reported an exceptionally high number of COVID deaths in children. The official figure is 832 children under the age of 5. Unofficially, it's over 1,300. That's far higher than any other country.
We have patients now in their 30s and their 20s, severe intubated patients. I think maybe the virus has mutated, become a new strain.
Delay in diagnosis and treatment aside, the higher mortality rate in Brazil is mainly related to the extremely infectious P1 variant. It has spread rapidly and quickly overwhelmed Brazil's healthcare system.
These patients here, they have been improvised in this semi-beds. They are hooked up to oxygen, but the hooks that are supposed to feed one patient are feeding 2 or more.
Apart from Brazil, Indonesia is also reporting high COVID death rate among children. In many cases, post-testing positive, children are also suffering from multi-system inflammatory syndrome, and it's proving to be fatal. This condition generally starts with a fever 2 to 6 weeks after getting infected with COVID. The organs and tissues can become severely inflamed. The symptoms may lead to blood clots, poor heart function, or kidney failure.
There's a lot of cells and cell signaling in the body that is just going crazy. And what that's doing is it's creating a lot of inflammation that's affecting the heart, the liver, the kidney, and really all the cells of the body.
While there is no official data for COVID fatalities among children in India, the fear is that a third wave will hit them hard. The health infrastructure is being ramped up, keeping this possibility in mind.
A phase 3 is inevitable, given the high levels of circulating virus. But it's not clear on what time scale this phase 3 will occur. Hopefully, incrementally, but we should prepare for new waves. Previous infections and vaccines will cause adaptive pressure on the virus for new kinds of changes which try to escape it. And therefore, we should be prepared scientifically to take care of that.
The US and Canada are already vaccinating teenagers, while India is currently testing vaccines on kids. It's a race against time to safeguard the young ones from a virus that is coming in waves and sparing no one. With Nivedita Singh, Anisya Kumar for CNN News 18.
Realistically, a vaccine for kids above 12 is still some time away in India. With that, it's a wrap from me. Thanks very much for watching.